Good evening. My name is Richard Rosen. I'm a Vice Chair and Retina Service Chief at the New York Eye and Ear Infirmary of Mount Sinai. The Navilas 577, which we're talking about today, combines the latest technology in laser application. It features the yellow 577 color laser. It has the ability to use either continuous laser or it can be used in a micropulsing mode. It has the major advantage of having an eye tracking system, and it has a built-in fundus camera, which allows you to record and also do treatment planning. One of the great things about the system is that the view that the physician has is a wide field view as opposed to the very narrow slit that we're used to when working with a slit lamp laser system. Here's a comparison between the composite view of the Navilas laser system to the Optos wide field system. And the Navilas is being imaged through the Mainster PRP 165 lens. By pre-planning, you can ensure that you've covered the entire area. You can spare the vessels. You don't have to play around with different shapes the way you do with other pattern lasers. You basically paint the grid within the area that you want. So everything is prepared ahead of time, which allows you to consider really the optimal arrangement for laser treatment. So this is a 47-year-old male who has proliferative diabetic retinopathy, a history of neovascularization of the disc in both eyes with some preretinal hemorrhage and some traction. When you look at the fluorescein, you're struck by the large areas of capillary non-perfusion, by the absence of viable retina, and by the number of areas of neovascularization, both of the disc and elsewhere. So here you capture the image, and then onto this image, you can apply all of the patterns in the areas that you want to treat and basically paint very easily. It's very intuitive. It's not as mechanical as many of the systems out there. And you can use the magnifying feature to allow you to see exactly where you've treated and make sure that you're not treating any neovascular vessels or large vessels that may potentially bleed. At that point, we have two areas that are non-treatment areas, and you can see the cursor, which rotates. Once you do initial spot, you can flip on the color for a minute and take a picture, so you can see whether you have the exact level of treatment that is necessary, and then the rest of the treatment can be done under infrared. You have to apply your foot pedal to activate the laser. So it's not doing this on its own. It's responding to the operator. You can see that when the operator decides to stop, there's a notification. Then it takes a post picture and it creates instantly a record which shows you what's performed. Here's another example that were not done in our particular institution, where you can see that it was used to treat this retinal tear or to treat around some lattice degeneration. As far as the lattice degeneration, there's a very nice grid that was applied enveloping this lattice degeneration. And we use this especially in patients who are at risk where they've had retinal detachment in the previous eye. And we know that we want to avoid the same thing happening in the particular eye that we're looking at. So the advantage of this is obviously that you have very evenly spaced spots, so you avoid over-treating certain areas and under-treating, which is often the case with these disjointed grids for many of the pattern lasers that are used. You have a very rapid delivery without having to worry about positioning, which makes it much easier for the patient because you can get through the treatment in a short period of time, and that's going to make them much more comfortable. You have this wide overview, and then you have, of course, very good documentation. And at any point in the treatment, if the patient is not feeling well, or if one of the observers feels that you should stop, if the attending feels that there's some issue, that's not a problem. Using the wide field fluorescein to guide is very helpful. Just to sort of sum things up, New York Eye and Ear, we introduced the system to help our physicians, to help our patients, to ensure the accuracy of our treatment. It really provides a superior form of laser, which is in keeping with the more advanced technology of our imaging systems that are available today. By doing this pre-planning, it takes a lot of the fatigue and stress from the physician, and it also makes it much more pleasant for the patient. And the results from studies that were done with the system show a reduction in the number of injections that are needed because some of those persistent areas of leakage are handled very efficiently and completely.